People across the country have been using weight loss drugs in an attempt to boost their health. Here to tell us a little bit more about the impacts that the weight loss shots have on folks is Dr. Erick Bulawa with Ballad Health. Thank you so much for joining us today.
Thanks for having me.
Absolutely. So we know that right now there's a big craze when it comes to weight loss shots. It seems like we're hearing it every day in the headlines. But let's talk about some of the positives and the negatives of these new weight loss shots.
These weight loss shots are FDA approved. Zepbound, Saxenda, Wegovy. They mimic hormones from the stomach that tell the brain to stop eating, to turn off their food thoughts and their food cravings. And that's how they work.
And let's talk a little bit about which patients these shots are for.
We have 4 categories of drugs that we use for weight control. And the injectable GLP-1s are just one of them, one of the categories. So all patients who have excess weight can utilize the injectable drugs, but there's also stimulant medications that can be used that are FDA approved, like phentermine and Vyvanse. Those work in the brain to turn off your hunger and your cravings. They're controlled, they're Schedule 2 and Schedule 4, so patients have to be monitored. There's other drugs like topiramate that can help with food cravings also, and is often combined with the stimulant medications for FDA medication called Qsymia that's available. And then there's a third category of drug called Contrave, which is not controlled, combines Wellbutrin and naltrexone that helps stop craving too. Those 3 categories are also used for weight control. So we just don't have the injectable drugs to use, especially since their availability is limited. We have other medicines we can also use.
And you know, we hear a lot of negative things about these drugs, but let's just walk through some of the pros and cons about these shots in particular. As we hear, you know, there are a lot of different options and ways to get them right now.
These medications help you lose weight. And if you stay on the proper nutritional recommendation, you can get down to much lower weight that can resolve the comorbidities like blood pressure, diabetes, fatty liver, hypertension, and that's the advantage of these medications. But you want to try to stick, if you can, to FDA-approved medications because they've studied the efficacy, they've studied the safety, and it's been approved. Same with the other 3 categories we discussed. The problem sometimes with compounding, these are not FDA-approved medications. They have not been studied for safety or for efficacy, and they do not contain the actual chemical that is in the name brand drugs. These are off-label use.
And let's talk a little bit about what happens when you stop taking them. Is this something that you take for a little bit and you get down to that goal weight maybe and then you stop? What's next?
The disease of obesity, excess weight, is a chronic illness, and it will deserve chronic treatment, whether that treatment is exercise, proper nutrition, or behavioral control. But even then, that may not be enough to control the food thoughts and the food cravings that most patients experience. So they'll be using these medications long-term, intermittently, but I think that's a tool that they need to have available so they can control and maintain the weight that they do lose for overall metabolic health.
And let's say that somebody is at home and they're watching this today and saying, maybe I should, you know, talk to my doctor about this. What's a great conversation starter for those folks?
Just asking their clinician if they have diseases associated with excess weight, and is it going to be beneficial for me to lose weight? And the general answer is any weight loss is going to prolong your life, improve your metabolic health. So everyone should be, who has trouble with excess weight, should be looking at that.
Well, Dr. Bulawa, thank you so much for joining us here on First at 4 and for all of this information. But if you have questions about the weight loss shots, it is recommended to contact your doctor's office. You can also reach out to Ballad Health by calling the number that we have there for you right there on the screen.